The glutes are incredibly important for being the primary drivers and stabilizers for your entire lower body. The glutes are made of three different muscles. The gluteus maximus, which is the biggest outer muscle that makes the buttocks region, and the gluteus medius and the gluteus minimus, which is the smallest one, as you can tell probably by the size of things. And they are the primary stabilizers to your entire lower extremity. So think of the backside being able to get you to stand, for you able to have range of motion, for you to bring your hip backwards, what we call hip extension, to give your pelvis stability, especially when you're standing and walking, and acting as a shock absorption through your spine, hip, and knee, and then gives you that balance to keep yourself upright. I've started strength training honestly because of all the data that's coming out and how important it is. We should start in our, 20s, 30s, 40s, right? And it used to be that, oh no, weight training is a young person's activity, but it's not. You exponentially lose muscle over time. So if you don't keep it up, that's a problem. The best way is by strength testing. So if you can do a single leg stance, meaning you stand on one leg and you can balance, that means your glutes are actually probably pretty good. The problem if your glutes are weak and you're just standing on one leg and you're isolating it, then you'll tilt to the side. That's problematic. Your body will compensate for it. We actually call it something called a trendelenburg gait or a lurch, where you kind of move to the side. Your whole body throws its weight over to see if it can compensate for it. When you're walking with 2 feet at a time, you don't notice it. But when you start doing single leg exercises, that makes a really big difference in assessing the strength of your glutes. Women can potentially have weaker glutes, especially with age, because we have hormone changes that can actually lead to muscle loss. We also have wider pelvises, so the demand that we put on our glutes actually make a difference. So we really need that gluteus stability because our pelvises are wider at baseline. And potentially as we get older, we become more sedentary. So as we become more sedentary, that also affects our glutes. So as women, we need to get up and move more. We need to get up and exercise more and keep up that strength throughout your whole lives so that we can live long, healthy lives.